Hello friends, in today's video we'll be discussing about some basic exercises for your lungs, some basic breathing exercises, something which you guys have been requesting us for quite some time, and I find the need even more now considering all gates have been opened for the revival of the economy. So the next 5 minutes our physios will be giving you some exercises which you can actually carry out in your living room, and also some exercises with a small instrument called the spirometer. Now the spirometer actually helps give you what your basic lung capacity is right now, and also will serve as a guide as to how much you're improving on your lung capacity as well. So it'll help be as a guide and also as a motivator for you to keep working on your lung exercises. Now it's very easily available as well. Now, if you're very reluctant about using the spirometer, however, you can switch to blowing some balloons and try and assess the amount of air that you're able to fill in one shot in a balloon, or the number of balloons that you can fill over say 2 minutes or say 5 minutes, and try and keep improving on it. Now, who are we targeting in these exercises? Basically, elders who are stuck to the bed, people who have some amount of paralysis, people who are having COVID and who are quarantined in their house and trying to get out of the illness, people who are at risk of developing COVID, which is basically everybody, and people who have come out of COVID, very importantly, because there is a very permanent damage which the lungs actually undergo during this COVID illness. So we need something to revive your lung function back to its original status. Now, the other instrument that I will recommend you to have in your hand is actually a pulse oximeter. Basically, it helps assess your oxygen saturation. Values above 95 are considered to be normal. So try and practice these exercises. Let us know your feedback if you have any doubts as well. So all the best.
Pursed lip breathing. You can do pursed lip breathing at any time. Pursed lip breathing may be useful during any activities like bending, climbing, etc. For doing pursed lip breathing, sit on your chair comfortably. Relax your neck and shoulders. Now inhale with your nose. Now purse your lips as you are going to whistle. Now breathe out through your pursed lips. Do this practice for 5 minutes. Diaphragmatic breathing exercises. Diaphragmatic breathing exercises help you to use your diaphragm properly. Do the diaphragmatic breathing exercises when you feel relaxed. For doing these exercises, lie on your bed with the knees slightly bent, pillows placed under your knees. Place a pillow under your head for support. Now place one hand over the chest. Now place other hand below your ribcage over the diaphragm. Now gently breathe in through your nose. While doing this breathing, you can feel the moving of the abdomen against your hand placed on your abdomen. Now purse your lips as you are going to whistle. Now breathe out through the mouth longly and slowly. Repeat this breathing for 5 minutes. Alternate nostril breathing. Alternate nostril breathing is the breathing exercise for relaxation. It also helps to reduce your heart rate. To start this exercise, sit on your chair comfortably. Bring your right hand close to your nose. Now bend your index finger and the middle finger. Then extend the other fingers. In this position, bring your right thumb to the right nose. Close your right thumb with your right nose. Now inhale through the left nostril. Now close the left nostril with the other fingers and release the thumb to open the right nostril. Now exhale through the right nostril. Then inhale through the right nostril. Now close the right nose with the right thumb and open the other two fingers. Now exhale through the left nostril. This is one cycle and center. To do this exercise, sit on your chair comfortably. Now slightly bring back your elbows to expand your chest. Now take deep breath through the nose. Hold the breath for 5 counts. and breathe out through the nose. Do this practice for 5 minutes.
Okay.
Sit upright on a chair. Hold the spirometer straight. This is the mouthpiece of the spirometer. Hold the mouthpiece. Hold it tightly. Now take a slow and deep breath through the mouth. Try to lift 1 or 2 or 3 balls. Repeat. After lifting, try to hold the balls for 2 or 3 seconds. Then exhale through the nose. After a deep breath, take some rest. Then repeat the process for 10 to 15 times.